can start thinking about what measures first we can lift. So really, next week is going to be crucial. There are a couple of difficulties in making this work. There are more than a couple, but a couple of specific difficulties that we have in Shawnee County, I think, in making the forecast of what's going to happen. And one is that we are lagging behind the state for whatever reason, either because we implemented a social distancing measure very early, or just because we were lucky, or because of our geographical location. But for whatever reason, we are lagging behind the state, especially places like the Kansas City area, Johnson, Wanda, Leavenworth, and so on. What it means is that we started later with our cases, and we are still growing more slowly than in some of the other counties. That is a good problem to have, I would say, right? Because we have fewer cases and we started later. However, it does make it a little bit more difficult to anticipate what's ahead, because it doesn't really tell me if our small number of cases now means that once the state starts going down, we will also go down at the same time, or it means we are just, maybe a week behind the rest of the state, and so we'll still go up just like the rest of the state has done before us. So again, next week will be critical for us to analyze the data that we collect continuously and we analyze continuously. I just want to say thank you. Thank you, Topeka. Thank you to all of you. I go around as little as I can. I must confess, a few times I take a little longer route, not because I also enjoy it, I will be honest, but mostly because I need to get a sense of what's going on in our city. And I see few people around. I think I showed you last time we talked, the picture at Gage Park on a Sunday afternoon, where there was absolutely nobody at the playground, which is the way it should be. There were people walking around in very small groups and keeping social distance. We still have some crowded parking lots, and I don't like that. And we may take a look next week and see if there is anything more that we need to do about that. So I know that there are some people that are still thinking that they can beat this virus, and that maybe, yeah, they told me not to go out, but it's been 2 weeks already. I need to go out now, and maybe they make a social event out of it. But most people are doing the right thing. I want to stress that. I get calls and emails from, hey, but this is worthless because look, they took this picture at the parking lot of this or that store and look how crowded it is. True, I don't like that. But I took a picture at Gage Park, it was empty. And I drive around and I see that the streets are not nearly as full and packed and crowded as they were 3 or 4 weeks ago. So most people are doing the right thing. They stay safer at home. So thank you, Topeka. If you are for those of you who are part of the group, those of you who are still packing the parking lots, please stop. Do the right thing. Be good citizens. This is not just about protecting yourself. It's primarily about protecting people around you. You may be infecting people. You don't even know that you have been infected, because that starts 2 or 3 days before you develop any symptoms. Just stay home unless you need to go out to fulfill some immediate essential needs, and stay out just as little as possible. For all the rest of you, keep doing the good work. This is not the time to get tired and let the guard down. Yes, it is time to get tired. I guess we are all tired. It's certainly not the time to let the guard down. There is an end, I promise. There is an end, and the end is much closer now than it was 1 or 2 or 3 weeks ago.
Thank you, Dr. Pizzino. Next, we'll have Mayor Michelle De La Isla introduce the Shawnee County Community Cares Line. And that group has been made up of a very dedicated group to make sure that this line has been started and will do good things in our community.
Uh-oh. I think we lost Molly.
I think we did.
But we can still see you, so I would suggest you go ahead, Mayor, and hopefully she'll be able to reconnect soon.
Okay, so I hope that we can remind Molly to come back to do this in Spanish really quick. But I am extremely proud of the group that I'm about to introduce. A few weeks ago, when we were first in the wake of this pandemic, and we started taking measures with regards to what we felt was necessary, our team started looking at a Maslow's hierarchy of needs type of strategy for the whole community. And we understood that belonging and feeling love and being cared for was one of those things that was going to be extremely difficult to do, especially when we were asking people to social distance. We've had a lot of volunteers in our community talk about how they want to do something, how they want to take care of each other. And one of the things that I was trying to figure out was how do we get people to call each other, and immediately reached out to Bill Persinger and to Family Service and Guidance Center, and spoke with those two amazing leaders, and they immediately started thinking about how we could make this happen. And of course, in typical creative fashion, Brenda Mills and Bill Persinger immediately figured out a resource in our community that can help us with call lines. And Bill, in his infinite wisdom, said, you know, this sounds, instead of it being a hotline, it would be great for it to be a warm line. And we immediately got our team working together. We ended up having Susan Kamen lead the team to see how we could make this happen and the implementation of this. And now our community is going to have yet one more way for us to continue to demonstrate the value of caring for our neighbor while we're safe at home, and just being able to take care of each other. So if the team, Bill Persinger or whoever the spokesperson is going to be for this, can get their camera on so that they can talk a little bit more about the project, that would be phenomenal.
Mayor, that would be me, Bill Persinger here at Vallejo. Thank you for that introduction. And we are honored to serve, and hope I'm coming through okay. I want to thank you for reaching out to your mental health and addictions treatment providers, Vallejo and Family Service and Guidance Center, on a Sunday afternoon. You were working away on behalf of all of us, and kudos, many kudos to you and to the city. Also want to thank Director Oakes, Linda Oakes, and the team there at Shawnee County Health Department, Susan Kamen and Amanda and others. I want to be sure and thank our county and our county commissioners. Amy Kopp-Hasty, who is our development director here at Vallejo, is also on the Shawnee County Community Cares line development team. So thank you, Amy. Dr. Abby Callis over at Family Service and Guidance Center. Thank you, Abby. Jessica Barraclough at United Way. Thank you and your team. Many thanks to Topeka Community Foundation for funding for the project, the Warm Line, and we're going to be calling it the Shawnee County Community Cares Line. And Amy will, and others will talk about that here in just a little bit. So I want to cue up Amy Kopp-Hasty. Also want to thank our colleagues at Health Source Integrated Care here in Topeka, particularly Colleen Medrano and CEO Patrick Yancey. But again, Mayor, hats off to you.
Hi, I'm Amy Kopp-Hasty. I'm the Development Director at Vallejo Behavioral Healthcare, and I'm one of several people that have served on the planning committee for the Shawnee County Community Cares Line. It's been a joy with this partnership to work with everyone in such a collaborative and creative way. The purpose of the line is really to show that there are people out there who care. We are a caring community, and we have so many people that have contacted the city and the mayor and said, how can I help? And one of the ways that the mayor and Bill and Brenda came up with was this line. And what we want to do is, in the social distancing lifestyle that we're all living right now, we want to make sure that there is a way for you to be connected to other people. it is so important to have someone to talk to and to have someone who can listen, and whatever that may be about. It could be really about any topic that you'd like to talk about. We're just trying to ease the idea that you're isolated or that you're lonely. People haven't been going to work. A lot of people are working from home. We're not in our social elements at the moment. You know, a lot of things, you know, have stopped to protect us. And so we're at home. And so now this line gives us trusted community volunteers who will pick up the phone. You call them and talk with them about whatever you need to talk to. Now, this is not a mental health crisis line. We do have those already established in the community. Vallejo has a crisis line. Family Service and Guidance Center has a crisis line for children. This is a community cares line to eliminate the idea that you're disconnected, you're lonely, you're isolated, and need someone to talk to. So without really anything else to say, I'll pass it on to Dr. Abby Callis.
Thank you, Amy. Yes, we are very excited about the line being rolled out this week, and we hope that people really see it as a valuable resource to help them feel connected again in their communities. I wanted to just briefly provide you with the phone number and the hours. The phone number itself is going to be 1-800-972-8199. It should be in operation Monday through Friday from 9 to 5 p.m. There are 4 available volunteer shifts, and I'm going to let Jess at United Way talk a little bit about how to volunteer if you would like to be on that end of the line as well. Jess?
Thank you, Dr. Callis. My name is Jess Barclow. I work at United Way of Greater Topeka, and we are honored and privileged to have an opportunity to be a part of this development team and to provide opportunities for our community to come together and talk, even if it is virtually in this time. And so my task to talk to you today is really about how can you volunteer. So we have worked with topekavolunteers.org, and that is our website. It is an online tool that allows volunteers to select and line up with opportunities in our community that interest them. And so we are using topekavolunteers.org as the platform to allow individuals in our community to sign up for this opportunity. You can do that today, right now. If you go to your browser and just type in topekavolunteers.org and scroll down on that main page, there's going to be a blue call out box that says warm line, volunteer for COVID-19 warm line, and you would select that, and it's going to provide you all of the opportunities that are currently available to volunteer. As Dr. Callis mentioned, I believe there is 4 different volunteer shifts throughout each day, and we have 3 lines available during each of those shifts. So we're really looking for 3 volunteers for every 2-hour shift during each day. And we plan on doing this until our social distancing is lifted. And so it's going to be a little while. It'll even extend beyond, I think, some of that social distancing being lifted as well. So there's going to be plenty of opportunity to volunteer. We are looking for a really big volunteer core to be able to help with this, so nobody feels like they're having to do lots of shifts. We already have over 25 volunteers that have supported and gone through the simple training process. So if this is something you're interested in, again, I would just encourage you to check out topekavolunteers.org, and you would create an account if you don't already have one, and then you can start signing up for shifts. And we even list other opportunities. If you are somebody who is interested in maybe doing a little bit more, there's all kinds of volunteer opportunities that are listed, and they're listed all the time, right? So whether it's COVID-19 related or not, this is going to be your central location to find opportunities to give back to our wonderful community. So thank you.
Thank you so much, team. This is really exciting news. And we have another group of individuals that are here with us today. As you can all imagine, there has been a lot of confusion with regards to the stance, with regards to what's going to happen in Easter and whether mass gatherings are going to occur. And with us today, we have two representatives from the Catholic Church that I've had the privilege of been working with for a while. We have Father John Riley from the Archdiocese. If you can turn your camera on, Father Riley, and also your microphone, that way we could give you the floor. Thank you, Father John. How are you today?
Oops.
Perfect. Yes, we can hear
Yeah,
you.
you can hear me? Okay, great. Yes, I'm
so
doing well.
I will bow out and you have the floor to talk a little bit about your position with regards to how we are going to celebrate Easter for now and a little bit of what's in your heart. Thank you so much for being here.
Yeah, thanks for inviting me. I'm sorry, could you repeat the question? I just joined in and just got my volume up just a minute ago.
No worries, Father John. We are introducing you as our representative from the Archdiocese, and we had discussed you talking a little bit about how we're planning on celebrating Easter in Catholic churches around our community, and
Right.
your stance in the Catholic community as well, the stance with regards to why we're all safer at home.
Thank you. Yes, we are all safer at home. I agree. Back on March 17th, the Archdiocese canceled all public masses going forward. So we've not had any public masses since then. We are allowing funerals and weddings. We don't do weddings during Lent much, but funerals certainly during Lent, but no more than 10 people. And that's including the priest or deacon who would be assisting at the mass or at the funeral. So that goes also for our Easter services. So right now we're in the first or the second of 3 days into what we call the Triduum liturgies. They also are closed to the public, only 10 people or less. So you might have a cantor, maybe a musician, the priest, and then maybe someone running the video equipment. And that's all. That's what they're limited to. And that's how we're celebrating live streaming to all of our people. The Archbishop is live streaming all of his liturgies and through Easter Sunday. And we've encouraged everyone to please stay home. The churches are not open. They've been locked except for those few who are assisting at Mass. And that's how, unfortunately, we're going to celebrate the resurrection of our Lord, but all in communion, just via a live link like this.
Thank you so much, Father John. Father Greg, would you like to say a few words to our viewers?
Sure. Hello, and thank you all for all that you're doing to keep our people safe. And yeah, I'm a local pastor here in Topeka, and doing as Father Riley said, we have not had public mass for, I don't know, what is it, 3 weeks now? And we've been live streaming services. And yeah, we believe that practicing faith, the number one is love. And to love everyone. We don't want to put them at risk. We don't want to transmit this virus, overwhelm our hospitals. We don't do any of that. So temporarily to lay down all of that, lay down our life in a way for the other. It's a way to follow our Lord Jesus. So out of love, yeah, we've canceled all that live streaming, and we know it's temporary. We hope to get through this. Whenever that day is, we can pick back up. I know there's that constitutional right we all have, but there's also, every right has a responsibility. And the right to vote, we got to do it responsibly. The right to practice religion, there's a responsibility to do that for the good of all, not to harm anyone. So that's, yeah, we've laid that down, and people are praying at home and tuning in, and it's working for them at this time. So thank you all for what you're doing.
Thank you. At this point, I am going to transition to give a small recap in Spanish of everything that has been said. So please bear with me while I try to go through these notes really quickly. La señora Linda Oaks reportó hoy que hay 59 casos vigentes de COVID-19 en la ciudad de Topeka. Hay 30 casos activos, 15 personas que se recuperaron y 3 personas que han fallecido. En adición, la señora Oaks dijo que por favor las mascarillas que están utilizando nunca las usen con niños que tengan menos de 2 años, porque les puede causar asfixia, que se asfixien. El doctor Pezzino habló un poco sobre los casos en la comunidad y estaba diciendo que ahora mismo estamos bajo la orden ejecutiva de la gobernadora Laura Kelly y estaba indicando que esa orden, si se acaba esa orden, nosotros estamos vigilando mucho esas próximas 2 semanas para nosotros tomar una determinación en cómo vamos a reaccionar referente a eso. Queremos que sepan que en la ciudad de Topeka y en el condado de Shawnee, 10 de los casos reportados de los 59 fueron casos que están en la comunidad. Eso quiere decir que son personas que no saben cómo se contagiaron, que no pueden decir que estuvieron en contacto con una persona que estaba positivo. 8 personas fueron personas de los 59 que están enfermos, son personas que trabajan en el sector de cuidado médico. Y una de las muertes que tuvimos es una persona que está en el grado, en el sistema de cuidado médico. Así que es muy importante que nos quedemos en casa porque estamos afectando no solamente a nosotros, sino que también al personal médico que nos está atendiendo. Estamos muy contentos de que porque ustedes están escuchando y están haciendo respetuosos al pedido de que estamos más protegidos en casa. Hemos visto que el crecimiento del virus ha sido un crecimiento gradual, pero el problema es que si la semana próxima vemos que el número crece doble, entonces sí vamos a tener problemas, porque quiere decir que hay una infección mayor que se está propagando en la comunidad. Así que si vemos que la infección la semana próxima y la semana que sigue siendo una infección gradual, entonces lo que vamos a empezar a hacer es que vamos a empezar a ver qué medidas podemos empezar a relajar poco a poco para que lleguemos nuevamente a un grado de normal, ya sea normal, que no sabemos lo que va a ser normal en el futuro, ¿no? Todo va a depender, las medidas que el doctor Pezzino está viendo es cuánto tiempo se está tardando de ver el efecto del virus, de cuando le dicen usted tiene coronavirus a que se ponga grave. Estamos viendo cuántas pruebas estamos haciendo en la comunidad y estamos verificando a ver cuánto rápido está creciendo el virus en nuestras comunidades. Como le dije, si se duplica, estamos en una situación de problema. Una cosa buena que queremos decirles es que estamos muy contentos de que estamos nosotros detrás del Estado. O sea, el Estado como tal tiene mucho más casos que nosotros en el condado de Shawnee y le agradecemos porque no somos nosotros, son ustedes que se han quedado en casa. Otra cosa que se anunció hoy fue una línea que le llamamos el Warm Line, que se va a llamar Shawnee County Care Line. Y básicamente es una línea de apoyo para llamar. Si se siente solo, necesita alguien que le dé una llamadita, a preguntarle cómo está, a saludarle. Nosotros vamos a tener una línea en la comunidad que va a ser corrida por voluntarios en la comunidad. Así que si usted habla español y tiene tiempo para dedicar, tenemos unos espacios disponibles. La línea va a ser abierta de lunes a viernes de 9 a 5. Y el número de la línea que empieza el lunes va a ser 1-800-972-8199. Estoy muy agradecida al grupo de Health Source, a Colleen y Patrick, que ayudaron muchísimo con su centro de llamadas. Y muy agradecida a Bill Persinger y agradecida a Brenda Mills de Family Service and Guidance Center. Y Bill Persinger es de Valeo. Valeo es la organización de salud mental de nuestra comunidad. Hablamos con el padre John Riley y el padre Greg Hammes, que son padres de nuestra iglesia aquí local, y el padre de la arquidiócesis de Kansas City, y nos estaban diciendo que ellos están diciéndole a todo el mundo que no es el gobierno que les diga que no queremos que participen de los rituales religiosos. en esta época de Pascua, sino que lo que les están diciendo a todos ustedes es que el amor y la responsabilidad que tenemos por los derechos, el derecho que tenemos tiene una responsabilidad que viene con esa. Y me encantó lo que dijo el padre James, que dijo que es un momento de demostrar amor y demostramos amor por dejar nuestra habilidad de estar en público. Es un momento de sacrificio, ¿no? Porque estamos reconociendo que el estar afuera perjudica a otros. Así que ellos están de acuerdo y no vamos a tener misas en la ciudad de Topeka y en el condado de Shawnee. Estamos colaborando juntísimos todo el tiempo y le agradecemos todo lo que están haciendo para que se mantengan seguros. Finalmente, le quiero decir a todos ustedes, miren, eso es difícil. Yo les quiero admitir que personalmente para mí no ha sido fácil estar en mi casa todo el tiempo y no estar afuera y tener un poco de miedo, ¿no? Porque me ven a mí siempre con una sonrisa y fuerte, no quiere decir que eso no me está afectando, al contrario, me afecta muchísimo, nos está afectando mucho. Así que por favor, mire, yo en la página estoy poniéndole cuando salgo a caminar, cuando me voy a correr bicicleta, hay formas muy positivas. Hay veces que yo llamo a mis amistades para dejarles saber que no estoy bien. Está bien no sentirse bien. Esto no es natural, pero les recuerdo que esto es temporero. A nuestros negocios pequeños que están a través de toda la ciudad, les queremos decir que también sabemos que están sufriendo, estamos tomándolos en cuenta y no nos hemos olvidado de ustedes. Sabemos que esta economía está muy difícil, pero no están solos. Estamos trabajando ahora mismo con un equipo para ver cómo podemos llegar otra vez a la recuperación de nuestra comunidad. Así que muchísimas gracias. Y ahora voy a decir en inglés un poco de lo que dije ahora en español. I just finished my Spanish remarks and I do want to wrap up by acknowledging a few things. To all of you who are watching, I know that all of you may see that our team that is out there and it's presenting to you typically has a smile, and you see us that we look like we're strong. I want to tell you that even I am struggling some days. Our team struggles. Even though we are doing a great job and we have an amazing team, all of us are struggling with the impact of COVID. As you see, I'm in my house. There is no such thing as normal, and there is a lot that we are grieving. However, all of this is temporary. I have been extremely open when I'm having a stressful day. I just get on my bike for a lunch break instead of eating, and I'll just let some of my stress out there, or I'll take my dog for a walk. It is okay to be stressed out, and it is okay to express it and liberate it in positive ways. So make sure that you use that warm line. Make sure that you call people that you trust. It's okay for you to say that it's not okay, because it's not okay. This is not normal. Nobody is excited about this situation. All of us are struggling right now, and it's normal that you are. I just want to let you know that it's okay for you to admit that everything is not okay. We may be smiling, but we're right there with you sometimes. And finally, I did want to say to our small businesses, we are looking into ways that we're going to start working together as we're looking at the next 2 weeks, like Dr. Pezzino said. That means that we're also starting to talk about how we're going to recover back and what things we're going to start bringing on board and how things are going to look, but it's all going to be dependent on the virus and how it's propagating in our communities. So thank you all, and I'll call Molly back to moderate the question portion.
Thank you, Mayor. I've changed locations a little bit. My internet connection dropped upstairs, but I just will open up the floor for questions right now. Please direct your question to whoever you want to answer it so they can be prepared to answer the question. And I see we've got Sean Wheat up first.
All right, Molly, thank you so much. This one is for Dr. Pezzino. Doc, we heard from the Kansas Department of Health and Environment. They actually started talking about wanting to do community testing. Have you had any guidance from the health department on how they could potentially do that in Shawnee County, or has that even been discussed at all?
No, we have not received any guidance yet. I think it's a little premature. Any kind of community testing, we have to follow some protocols and test kits that are developed at the federal level and approved at the federal level. My understanding currently is that community testing will be helpful not as a diagnostic tool. So when we say community testing, we need to be clear. We are not going to test just about anybody who's walking down the street to see if they are sick, if they have the disease. We're going to test them to see if they are immune. So if they have had the disease, and so they show antibodies. That's my understanding, but it's all very preliminary. information. So there is no immediate plan yet to do that.
We've got Mackenzie Davis up next. Mackenzie, you need to unmute your mic. We can't hear you.
You are unmuted now. Yep.
Okay, we still can't hear you. Can you type your question into the chat? All right, while you're typing your question, Sean's got another question, so we'll let him ask it.
Dr. Pizzino, this is again geared towards you. When it comes to the virus at Shawnee County, you said you have the data next week. You're going to have to look at the data next week. Now, can you talk about, are you going to be looking at last week's data, the last day's data? I mean, what data do you have to look back at to determine if we have hit our peak and are on a downward slope?
Right. Well, first of all, we have been looking at the data since day one. And so it's not something that we're going to do something new that we're going to do next week. I receive an updated spreadsheet with information about new cases just about this time every afternoon. And I look at the things that I listed before. So I look, of course, the number of cases that we have, when their date of onset was. So it's more important to look at date of onset than the date that they were reported, because there is always a lag between when people get sick and when we receive the report. I'm going to look at things like the proportion of cases for which we do not know a source of infection. Ideally, we want to keep that to a minimum, because in the ideal world, if we had a good tracking system, we would be able to identify most of the contacts that every case was in contact with, and then put those people in quarantine. And those will be the people that then eventually, during a period of up to 14 days, some of them might become also sick, and they become individuals with the disease. As I said, right now we have, what did I say, 8 or 9, I think, that are 8 cases that are 10 cases, I'm sorry, that for which you could not identify the source. We're going to look at the number of lab tests that were performed. We don't want to base our decision on a very small number of tests, because then we go back to the situation where we were 2 weeks ago. If we don't test, we don't know where the virus is. So we will look at all these trends, and we will make an informed decision with all these things. Unfortunately, there isn't really a magic threshold or number or formula that we can use. And, it's like a target. And when we reach the target, we know that we're there, and we know this is the right time to lift those social distance measures. It's going to take a lot of judgment as well as the data. The data is always going to be the foundation for the judgment, but ultimately we will have to look at the preponderance of that data, which direction the data points, and then make some decisions. And I can already tell you up front, right now, it's not going to be an all or nothing thing. We are not going to rescind all the social distancing measures all together, all at once. We start with some, and then still monitor the situation over a period of a week or so. And then if things go okay, lift it some more, and so on. It's going to be a progressive process.
Okay, it looks like Mackenzie's question is for Linda, and she wants to know, are masks still suggested to be voluntary, or are they required?
Yeah, masks are not required. Masks, and let me just talk about masks a minute. Masks keep you from giving the virus to someone else. They don't protect you, they keep you from spreading it. So probably a good idea if you're in a store or a social, where you be around more people. Hopefully you're not in social activities, but if you're in a grocery store where you might be seeing people. The other thing about masks I want to stress is it does not, we still want you to use social distancing. That's still very important. Sometimes masks give a false sense of security. So remember, wearing a mask is fine. Just be sure to keep your 6 foot, use your social distancing. masks will help remind you not to touch your face. So there's a good thing about masks. And then Dr. Pizzino, do you want to say any more about masks?
The main thing I would say, I don't discourage the use of masks. I think I said that last time. I use mask when I go in a place with public, with other people around me. They are no substitute for social distancing. And so I do not want anybody to think that they can relax their social distancing because they're wearing a mask, whether it's a professional mask, whether it's an N95 mask, whether it's a surgical mask, just a social distancing, you know, the 6 feet, that remains in place. And there is no substitute for that. Masks are not a protection for the person that wears the mask. That's one of the most important things. I think it's one of the most important misunderstandings that I still see around there. You are not protected because you're wearing a mask. You are protecting people around you in case you are infected and you don't know.
All right, we've got Sean Wheat next, followed by Mackenzie, who's going to type her next question, and then we'll have Matthew Galloway after that.
All right, my question actually is for Bill Persinger. Bill, when it comes to mental health, and maybe somebody on your team can also help answer this question. I know there's a lot of stress. There's anxiety issues going on right now with folks. There's folks out there who are teaching their kids and they have the anxiety of having to teach their kids when they're not teachers. Can you kind of talk about what your organization provides also for mental health to help folks other than the CARES hotline? I know that's a new program where you're just helping out people if they need somebody to talk to, but what other services are there for folks who are just kind of going, I need a little bit more help than that?
Well, there is the crisis line, you know, the hotline, if you will. It's on 24 hours a day. You can also walk into Vallejo if you need an intake for kind of, you know, matters that maybe of stress and so forth each day, or for immediate crisis concerns. Vallejo is still open. We've still arranged for people to get their psychiatric medication, both the oral medications and the shots. And so we've kind of kept our frontline programs open to the public, trying to do all that we can to protect the public and the staff and yet carry on with our essential mission. We've had quite a few opportunities through Facebook and the social media, but also through the radio, television, and other a newspaper and other forms of media to get the word out about how to manage stress and depression, maybe how to cope if you've got an addiction and you're recovering from that. You know, some practical advice that people can follow. So I would encourage you to check not only our local media and press, which have been great, by the way, Sean, you and the others, and but also check out Vallejo's Facebook page. You can go to our website. Family Service and Guidance also has a web page that you can visit, a Facebook page as well. Both of the hospitals and other healthcare providers have been great about putting out information on how to cope and deal and carry on.
Amy, it looks like you have your hand raised. Do you want to contribute a little bit to what Bill just said?
Just about to bounce over
I'd actually like to give you the 24-hour crisis line for Vallejo, because that is for mental health emergencies, as Bill was saying. So that is answered 24 hours a day by licensed clinicians that can help in mental health emergencies. And that number is 785-234-3300. And our crisis center is located at 400 Southwest Oakley, and that is a walk-in clinic for mental health emergencies. And you can just walk in there should you need help.
Might add also that Vallejo, good job, Amy. Might also add that Vallejo's main number is 785-233-1730. That's our main line. But Amy, do you want to go ahead and restate that crisis line number?
I sure can. It's 785-234-3300. That's our crisis line at Vallejo.
Thank you.
Mm-hmm.
Okay, while we're waiting for Mackenzie to type her question in, it looks like we had Matt Galloway had his hand up.
Yeah, I have a question for the mayor. Dr. Pizzino mentioned parking and Gage Park as two examples of kind of the good and the bad in terms of the community's response to the order. How would you evaluate how the Shawnee County residents are kind of conforming to this order, and would you say it's satisfactory to your expectations?
You know, it's really interesting. I had the same question this morning when I was in KCUR, and I said that for the most part, we're pretty satisfied with citizens heeding the instructions that they're given, they're being provided. But just like with everything, it's not just about the pandemic. I think that what we're starting to see is you're always going to have individuals that, because we don't have the numbers that we're seeing in the national media, are starting to wonder, why are these things being imposed? There's a lot of struggle with regards to small businesses. So even though for the most part, the community is listening, we still have pockets of the community that still don't understand why we're doing everything that we're doing, and that are concerned that we're impacting small businesses and that we're impacting people's lives, and still want to do their own thing. So for the most part, we're starting to see people collaborate with us, but there is still a contingency of individuals that just sees this as unnecessary.
Mayor, if I may add something, I think your point is very well taken, and I don't know what else we can do to impress upon people that just because we don't have refrigerated trucks parked outside of our hospitals to hold the bodies of people who died because the morgue is full, and what I'm describing is what is going on in New York City, it doesn't matter. It doesn't mean that we are not at risk. We are all at risk. And let me give you a number that maybe will act as a wake-up call for some of the people in our community. Remember I told you half an hour ago, we'll get new cases. Just during this conference call, we got the update for the day that our number jumped from 58 to 70. This is the largest increase ever in one day. The virus is still with us. It's circulating and it's transmitted from person to person. And many cases are transmitted in the community. So every time you go out unnecessarily, you put other people's lives at risk. It's as simple as that. And I don't think you want to be the one who's going to cause a disease to your brother, your sister, your grandparents, or even just strangers around you.
Okay, we've got a question for Dr. Pizzino from Mackenzie. She wants to know, what will the numbers look like in order for the safer at home order to be lifted? And what is the indication that the numbers are slowing down?
Well, the second part is probably the easiest. I mean, indication numbers are slowing down. To be clear, there is no indication right now that the numbers are slowing down. As I just said, we have the largest increase in one day. But when we look at those charts, you know, we have charts and we have numbers by day. If the growth goes down, slows down, that's pretty easy to find. The first part of the question is really more complicated. And as I was saying earlier, that's where it takes the judgment and the experience of professionals in public health to get the pulse of the situation, so to speak, where the number of cases is only one of the variable, one of the measures we're going to look at, but we're going to look at all those other measures that I listed earlier and trying to see where the preponderance of evidence is taking us. Where is that preponderance of evidence pointing us, in which direction? And then we will decide if it is the right time to start lifting, not to lift them all at once. I don't want to give people in false exclusion, but we can start lifting some of the measures a little bit at a time.
Thank you, Dr. Pizzino. Dr. Callis would like to speak briefly about the Family Service and Guidance Center services and crisis access for children, adolescents, and their families.
Yes, thank you. I wanted to make sure that we provided that number to everyone as well. If you have any young people in your lives who you feel like might need some additional assistance, Family Service is still open. We're taking new clients. We're serving our current clients through telehealth methods, and our crisis number and our main line is 785-232-5005. Our crisis line is 24/7. And please reach out to us if you feel like you would need that.
Thank you. We've also got another question from Mackenzie Davis. Mackenzie, is your sound working now? No, okay, I still can't hear you. So if you could type your question again. So she said, for Dr. Pizzino or Linda, we had a viewer question asking why testing kits are so rare. Are they going to hotspots first, or are they harder to make?
Those of you who have followed these press conferences that we have held now for weeks know probably how many times, remember how many times I complained about testing not being as widely available as we wanted. There is a variety of reasons why that happened, and I hope that at some point when things are settled, people will look back and see what went wrong, because this really created a big problem. And if we had more testing, if we had more testing at the beginning, I suspect that some of the extreme social distancing measures that we had to implement would not have been necessary. But it is what it is. So this is not the time to point fingers necessarily, and hopefully we will do better next time, because there will be a next time. However, the good news is that testing is really improving, we are doing many more tests now than we were before. And in fact, I can even give you some numbers. So just at the beginning of this week, we had more than 100 tests performed just in one day. And to give you an element of comparison, the previous week, we had 42 in one day. So the number is going up. And I also, I'm talking to the hospitals, and they are developing, at least Stormont Valley is developing in-house testing, so they will be able to do their own testing. Your question was what's the shortage? It's just about anything you can imagine, and anything and everything. There was a shortage of collection kits, so that's a swab that people use to collect the specimen, and then they need to send it to the laboratory. They had to extract the virus from that, and then you need to test it. There was a shortage of the reagents that could extract the virus, and then there was a shortage of the actual product that is used to detect the virus after it's extracted. So just about anything. There was a shortage of equipment. There wasn't enough equipment to run the number of tests that we needed. All that is improving slowly. It's not near where I would like it to be, but it's improving. So once we have testing available locally, I think that will also make a big difference. And the other thing we did, we are encouraging people and providers to test more. We are encouraging people to go and seek medical care if they have fever and cough, period. It doesn't matter if they travel, if they were exposed to somebody with coronavirus. If you have fever and cough, just call your primary care provider or do something else. And I'm going to show you in a second what it is. I'm going to share my screen. So if you go to the Shawnee County homepage, which is snco.us, you see here one of the top things under the picture, one of the top things is self-report symptoms of possible COVID-19. When you click there, you have a survey. It's a very simple report form. It takes about 2 minutes or less to complete. And people with symptoms can submit this form to us. And this form will be forwarded to a nurse at the health department who will call these people back and do some triage. And if the nurse thinks that testing is appropriate, is indicated, then testing will be done and the nurse will give directions how to do it. So I also sent a letter to all the physicians in the county, invited them to do more testing. So we are really trying our best. I think we have more capacity for testing now in the county. then we are doing tests. So the big bottleneck right now is not that we don't have availability of tests anymore. Again, it's still not perfect, but it's improving so quickly that the bottleneck is really not having enough requests for tests, because people, you know, it takes a little bit for people to get into the mindset that they keep hearing, oh, there is no testing, so they don't even bother. No, there is more testing available now for people who need it.
Okay, we've got another question from Sean Wheat.
All right. Last question is, can you kind of go, Ms. Dr. Pizzino, can you kind of go over the guidelines with, you can't, just because if we start seeing a downward tick in cases, yesterday we saw the highest ever, but if we ever start seeing that tick go down.
Not if we ever, we will. Don't say if we ever, because then I'm going to get depressed.
I apologize. When we do, I
It's okay.
apologize. Bad choice of words. But just because we start seeing the numbers start going down doesn't mean we can let up our guard and open everything up. Can you kind of talk about a little bit of the logistics of it'll still take an educated guess?
Well, yeah, as I said, let's go over some of those measures again, and then I will tell you what may happen. So we are going to look at things like, you know, the number of people that are positive. We're going to look at number of people who have been tested. We are going to look at whether these people were contacts of each other, so we know how they got infected, or whether they got the infection in the community. And then we're going to look at the measures that we have put in place. If you think about that, it has been an incremental process, and it was not a random process, of course. We started by you know, closing the schools, then we limit gathering size, then we limit the services that restaurants and bars can provide, and then we issued a safer at home order. My guess is just a guess at this point, and I reserve the option to do things in a different order. Schools are out of the question now for the rest of the school year. But for the rest, my guess is that they will be lifted in the reverse order that they were implemented. So my hope is that the first thing that we can lift when the conditions are ready is the safer at home order. I know that that is the most damaging to people's mental health, to people's economy, to our community in general. So I do not want to keep that order in place just 1 hour more than necessary. Then we will monitor the situation. Maybe next could be restaurants and bars, and maybe next could be the gathering. I don't want to give people false illusions. I want to give people hope, because there is hope. As I was saying a moment ago, the numbers will go down. They went down in New York City. They will go down in Topeka, Kansas. I can guarantee you that. I cannot tell you exactly when, and when they will go down to a point that these things can be lifted. It may take months before we go back to having no social distance restrictions as we had before the virus. But it will be a progressive process, so it will not be months where we have to stay in the same painful status as now.
Okay, I don't see any more questions. So thank you all for attending. We will have another press conference next week on Friday at 4 p.m.